Good afternoon. So I'm going to take you through introduction, epidemiology, and clinical presentation, and a bit of the pathophysiology of liver abscess in children. So as we know, liver abscess is really rare in children, but it does occur, and mainly it's the pyogenic liver abscesses that accounts for most of the cases. And the incidence is 10 per 100,000 in developed countries, and the incidence seems to be higher in developing countries. And studies have typically shown an equal incidence between boys and girls. It does also occur in neonates who have had umbilical catheterization, who have had overwhelming sepsis. And 50% of these children are younger than 6 years, but it also does occur in children above 6 years. It has also been seen in school-aged children. And a review of literature, really, most studies, there's no like a cohort study or something done for long. Most of them are case series. Most liver abscesses articles or literature you read is just case series, like in different parts of the world. But most of them came up, and the commonest cause is Staph aureus, followed by Entamoeba histolytica. And the overall pyogenic liver abscess constitute about 80% in children, and the incidence reported in Brazil is about 1 in 40. In South Africa, the incidence reported is 28 per 100,000. I couldn't get anything in Uganda. So, and predisposing factors usually are children who have had abdominal infection like appendicitis, children with debilitating diseases, granulocyte dysfunction, congenital or acquired immunosuppression. Also, we have children with congenital abnormalities of the biliary system. And usually when you have an obstruction in the biliary system or strictures, you tend to have stasis, and it's a way for the organism to proliferate. And usually children who have congenital anomalies are the ones who come with multiple abscesses, liver abscesses, because the staph and the other organisms usually give you a solitary liver abscess. Sickle cell disease are also predisposed. You know what sickle cell is, so they're also predisposed to having liver abscess. And also a study done by Kumar et al. Also showed that children with moderate to severe malnutrition are also prone. Actually, study showed 27% of children with moderate to severe malnutrition to have liver abscess. And then children with genetic disorders like papillon, and also inherited immunodeficiency disorders like chronic granulomatous diseases. So this child we are also still investigating for the inherited immunodeficiencies. We hope we can do some tests for. So in the pathophysiology, we know most of the infection occur through the various routes, like the biliary tract, like I said, and the portal and hepatic artery. So if someone has a systemic infection, they would probably just get, if you have a systemic infection, you can also end up with a liver abscess. And then infections in the portal bed can result to septic emboli, which as the blood flows through the hepatic veins, hepatic artery, they get trapped, and as they get trapped, they become like a source of infection to the liver, and that's how you can also get. And then also penetrating abdominal injury, like if you have a direct injury to your liver, you can inoculate the organisms directly to the liver. And then non-penetrating hepatic injury, if you cause like liver, you injured your liver, you get a necrosis, then you have leakage of bile. Also, it's a suitable environment for organism to grow. And approximately 2/3 of the liver abscesses occur in the right lobe of the liver, and majority are really single. But in our patient, that's why we took interest. There were multiple abscesses. And this is something to do with the anatomy of the liver, the volume of blood going to the right, like you take most of it there. So that's why you end up. And Mainly the causes, as we have seen, Staphylococcus seems to be the major organism cultured in the different case series I've seen, like majority are Staph aureus, but also there are cases reported of strep, and then we have E. coli, Klebsiella, Salmonella, an anaerobic organism as well, Entomoeba histolytica, Ostilitica, and Toxicana caries also can cause liver abscess in places which is in developing countries mainly. So the clinical presentations are usually very, I would say, not clear. Most patient presents with non-specific symptoms like fever, chills, night sweat. They can have their fatigue, nausea. Some of them will have right hypochondrial pain. And jaundice is not usually very common. Some of them may not have jaundice. So if you don't see jaundice in them, unless now, like our patient had a bit of liver enzyme elevated, and some of them come with right shoulder pain, which is due to the irritations of the diaphragm. And diagnosis can be challenging, as we are saying. For this patient, it took us quite a while to really come with the diagnosis of liver abscess, and they have also been in several places being treated for unexplained fevers. So, and this always delays management, and usually they come in when they are very sick. So high index of suspicion is necessary when you are dealing with a child, and usually the markers are the liver enzymes, and then also increase erythrocyte segmentation rate. Thank you.